How has your sleep been?
Well,
Yes, Professor.
Professor, I think one was quite specific that you were not deliberately asked not to participate in this poll.
thank you, Carol.
Yes. And this is happy hour, guys. So those
teacher student owe each other one thing. I taught you all the good things, you know, the bad ones you taught yourself. Now it's your turn to teach me.
Okay,
I'm a fallacious argument, the third one, but.
And I'm going to send you a different question now, the final question. This one will be interesting for Dr. Frank because these are his people, myself included. Over the past month, what has your alcohol intake been? And I'm very glad I'm not voting. We shall not discuss the poll right away. I want to go back to Carol Musyoka. We've called you doctor, you know. We've actually given you an honorary PhD from the Happy Place. This webinar is hosted by My Happy Place, which is a technology company by one of the current club members, Alison Giboine. So that is we who gave you the PhD from My Happy Place. Don't use it anywhere else. We might get into trouble. So what I would say is, what have you seen among your friends in terms of the changes that have been exhibited? I can say, like, for myself, I find that a lot of people who never were online, writing on WhatsApp, etc., are writing a lot, you know. Some of those guys who are always, you couldn't reach them. They're online throughout. What have you noted?
You know, it's availability. That's one thing that everyone is everyone is available. So, you know, especially if you try and do a drink up or a prayer meeting or whatever your choice of social gathering, you know, people are available. And if you say, can we meet at 7 p.m. because, you know, everyone's going to be home at 7, people are actually available. But Joanne, what I'm finding more interesting is, you know, the reports coming out that there's far less footfall going through hospitals. So the question I ask myself is, are we naturally hypochondriacs? Because if footfall can drop in hospital, what does that mean? That were we going there because, you know, we always thought that we were going to die and we had to go and see a doctor? And I don't know, maybe Dr. Jenga can opine on this.
Actually, my issue is that if today I have a tummy upset, I'm sorry, I'm not going to the hospital lest I get COVID there, you know? Yeah, so that's me. Dr. Frank, what's happening to us? Why are we not going to hospital?
Okay, I'll say two things very quickly. The first one is that not because he's my friend, but Professor Muigai has made some excellent points. I'll pick only one of them, because I think it's worth repeating. During the 6 to 8 weeks that we have been in lockdown, I have discovered, to my total amazement, a large number of incredibly clever young men and women, many of them doctors, who can run medical services without any help anywhere in this world. They have done webinars like this one to international audiences. They have discharged themselves in ways I did not believe possible. So let me agree with you, Prof, that this COVID thing is making us look inward and discover things about ourselves that we did not know. So in answer to your question, why are we having fewer visits? Is it because we are all naturally hypochondriac? No. I think Joanne has given us the less important reason. The less important reason is that we are not going to hospital for tummy ache because we're afraid of getting a bigger disease. That's it. The most serious one is because we are keeping diseases to ourselves. We are postponing them. For example, if ladies, let me just take the ladies by way of example. Ladies are told to check for breast lumps every month, whatever it is advice they get. Now, one is very careful. If you see a lump, you say, we can go and have this one checked next month. Sadly, and this is the tragedy, when this COVID thing goes back to where it came from, and then you go and see your doctor, you'll be a month, 2 months, 3 months late. So we're actually postponing. And there's a move, in the National Health Service to actually encourage people now to go back. I think the NHS saw a 40%, no, 60% drop in A&E visits in most places. It doesn't mean people are not hypertensive. There's a poor guy I saw, by way of example, who had a stroke, and he had a heart attack, and he decided to leave it out in his garden. The guy survived, but ordinarily he would have gone into hospital. So we are postponing many necessary visits. Of course, like Joanne, okay, you stay with your tummy ache. I hope it doesn't get worse. But I think postponement of illness is also a factor out of fear.
Thank you very much, Daktari. And, that really is a concern. And I wonder when it is that this will reverse, because then it means that we are going to get a lot of other non-communicable diseases that have been sitting and getting worse. Paula Nyaga is asking, what effect is this pandemic having on children who are always being told to stay inside, that there's a bad disease outside? Are we going to get a generation of recluse? What's going to happen? What happens to these kids? What is psychological effect, especially on very young children now?
Who are you asking?
I'm asking you, Dr. You're the only expert in the room.
I told you. I mean, but the truth is, the simple reality is that children are resilient beyond belief. And my expectation, and it's only worth it being my expectation, is that children, and by the way, even the adults, well-adjusted adults, will all bounce back. We may not go back to playing golf as well as we were playing before COVID, but I can tell you, all of us, the Juakali people will go back, the Matatu people will go back, business will go back to normal, relationship will go back to normal. We are defined as a people by our resilience. And I think these levels of resilience have been seen after every adversity that has visited humankind. So I wouldn't go around the city or around the club worrying about the end of the world. The world is far. Don't listen to those people who tell you it's finished. It's not finished.
I know, I agree with you totally, because I'm way too young for the world to end on me. Now, Professor Muigai, I've got a question for you. You're the guy here who understands how government works. What measures can the government take to ease the burden of COVID, mental stress on us as citizens? And what can we also do to ease it for each other and members of our family?
Well, I think government has already formulated economic responses to this. The stimulus package that it's being rolled out and so on. And maybe Caro is better placed to discuss that. And I think all that can do is cushion, minimize, but we probably will have already taken a hit. And I think that the measures one of the most impressive things for me, I hope I don't sound like a sycophantic commentator. I've been very, very impressed by the counties. As some of you may know, I had something to do with the writing of the Constitution. Some people say more than something. And one of the things I personally opposed was devolving healthcare to the counties. And I am very happy to say I have been proved wrong in some material respect. And I think counties have been quite responsive in this regard. One thing you haven't asked me that I would like to comment about is how this pandemic is impacting on culture. Because we will never go back. Some of the lessons we are learning, we will never unlearn them. I have always felt personally that we as an African people, and I know Frank talked about death and mourning and burial, I personally have always felt that we have invested more than we are economically able to shoulder in the business of burial. And I feel that the acceptance of cremation and expeditious disposal of those deceased is a positive impact or that culturally, in terms of the cultural changes that we will have. And I think that the more we accept that our culture can and ought to change, if these are the lessons we are learning, we should internalize them. And I personally think that that is something that we will never go back against, if for no other reason, because we have fewer people going to hospital, because they've discovered what the British knew a long time ago, that there is nothing a good gin and tonic will not fix.
Thank you very much. Thank you very much. I mean, it's very interesting because there's also a comment that has been made on why we're not going to hospital. And that's because we are no longer in the bars drinking ourselves silly and then trying to drive home. So we don't need to get to the hospital so frequently. Now, Carol, another question for you. Now, a lot of Kenyans are unemployed, about 39% of Kenyans. And right now with the economic impact, because this is both a human crisis and an economic crisis, what do you think is going to be the impact for employers and employees post-COVID?
Joanne, that's a very difficult question because you cannot be a purveyor of good news with regards to the answer on this. It's going to be tough. It's going to be extremely tough. Employers are having to make very drastic decisions. I've been front row center in many organizations where the decision on the table being made is, are some of these employees nice to have or must have, and is this a time that we need to be thinking about, shedding off what has been excess baggage, what we just didn't have the energy or the time to think about. Mm-hmm. So this is really, really going to be a difficult time. And then this goes back to our whole education system. And our whole education system historically from independence has always been geared towards moving us to going up into university, from primary school to high school to university to a white collar job. And we haven't been teaching entrepreneurship or just, lifting it up. So people who went and did business, they always say that the A players get to university, but it's the C players who end up hiring the A players because they're the ones who end up being the entrepreneurs. But if ever there's a time to be thinking about, now, putting aside that, thinking about looking for a job and thinking, what can you do? Let me use a Kenyan term. What's the hustle? What is it that I can do that I can keep myself gainfully occupied? Because looking for a job at this extremely hard. However, on the flip side of that, Joanne, is that this whole phase is also showing employees just how you can globalize your employee base. You don't necessarily only have to employ people who are in your jurisdiction. Everyone has access to Zoom and has access to technology. Your global companies can come out and look for talent beyond their local jurisdiction. So on the flip side, we will see a reduction, significant reduction, I hasten to add, but the opportunities also to now look for work outside of your jurisdiction will increase.
Thank you very much, Carol. Nothing I can add to that. And, as an entrepreneur, I want to say that not all entrepreneurs are C. Some of us were A and we are entrepreneurs, hiring fellow A. Had to plug that one in, and Daktari, and a question that I think really is important from the audience. What happens? How do we handle a member if they're, COVID positive or were COVID positive? How do we deal with them from a psychological place? There's a bit of stigma around it now, how do we handle it for a family member?
John, I did a whole webinar actually, on this precise question. Mm-hmm. I will not repeat that lecture because it was very well received. But the point here is that for a number of reasons, we have been made to fear almost more than we should. Let me just go broad a little bit and then I'll come back to the specific answer to your question. You might want to ask yourself, why in a continent of 1.2 billion Africans I think we've just reached 100,000 cases. You may want to ask yourself why in the same continent, the number of deaths, it's still less than 5,000. And the majority of those ones are either in South Africa or in North Africa. I don't know the answer to that, but there are some people who are saying the following things. Number one, we are being protected by our relative youth. If you look at our demographic, people under the age of 35, they're in the majority in our country. Secondly, there are those who are very happy about the weather that we have, sunshine, open windows, open doors, and air circulating all over, even in Gikomba and so on and so forth. And the third one is a possibility that the virus that came to us was attenuated, was less virulent, was less jokosi, was less of a killer than the ones that went to New York and other places like that. All this, as I've said, is speculation. So what is the answer to your question? The answer to your question is that more, not less education is a cure, a treatment for all stigma, whether one is talking about HIV, AIDS, tuberculosis, or whatever else one is talking about. And that perhaps is the genius and usefulness of this webinar. I hope that we are disseminating useful, if not interesting, information. If you're going to answer very specifically your question, an infected person starts off in a community, into the hospital, into the ward, into ICU, and all those ones have different levels of infectivity. And therefore, the measures that you need to take to protect yourselves change from time to time. Let me not repeat that lecture because we can do it another time. But I think more information is what will cure some of the concerns that are expressed by people without information.
Thank you very much, Daktari. And I think now we are right on the hour. I'd like to give you the poll results. And the question was, overall in the past month, how satisfied have you been with your life? And essentially 15% were very satisfied. 0 is not at all. 15% and 18%. 0 is not at all. 6 was highly satisfied. So most people were actually quite satisfied, the majority of Karenites. That is interesting. I would have expected a different response. I don't know whether we didn't understand the question. And then in the past month, how has your sleep been? 17% very good, 50% good, 28% poor, and 3% very poor. I will repeat, 17% very good, 50% good, 28% poor, and 3% very good. Over the past month, what has your alcohol intake been? Less than usual, 17%. About the same, 20%. I don't drink alcohol, 34%. More than usual, 28%. Not as high as I thought. So that's the responses from the audience. I really must come to the end of this webinar. We were scheduled for 1 hour. We are at exactly 19:32. We started at right on time. So one of the things that has come out very clearly is the appreciation of this session. Thank you, Daktari. Your insights, your experience, your expertise came shining through. I think for all the questions that we had, the answers that you have given really do meet the need. Professor Muigai, wisdom. We could hear from you speaking like a sage. We could actually get the meaning behind the meaning as you speak to the real issues around mental health and also life in general. Carol, awesome to have you on board. A different voice, speaking to us from the position of how corporate is operating, how as individuals we are operating, basically bringing it all around together what Professor and Daktari have said. I would say it's been an awesome evening. The concerns that have been brought out are really, really amazing. Culture, the concern of where are we going next, what next. And I think for all of us, as Daktari has rightly said, the only cure for all the concerns that we have is more knowledge. And right now, nobody has all the right answers. So we need to keep sharing knowledge. Thank you very much. I really want to thank the Karen Club for hosting this event. and for calling me in to host the event on their behalf. Karen Club, thank you so much. I really have been missing a happy hour. For those who are not enjoying this happy hour as much as we are, next time tell us how we can make it even better. It has been wonderful meeting up with you. Next time at the Sundowner, and have a lovely evening. Enjoy yourself. If you're good night, everybody. Bye-bye.